For individuals aged 60 and above, there is a seemingly harmless habit that can subtly yet significantly increase the risk of stroke during sleep. This condition often strikes without any warning signs or pain. One moment, a person feels perfectly healthy. The next, they may be unable to lift an arm, experience slurred speech, or suffer impaired coordination. Brain specialists have repeatedly encountered such tragedies among elderly patients. Remarkably, the cause of these conditions was not smoking, poor diet, or lack of physical activity, but something many mistakenly believed to be beneficial: vitamins. Specifically, vitamin supplements. Millions of older adults worldwide take various vitamin complexes daily, genuinely believing they're strengthening bones, boosting energy, or preserving mental sharpness. While many of these supplements do offer benefits, some, especially when taken in high doses or at the wrong time, can subtly put the brain at serious risk. This article will examine 5 common vitamins that can significantly increase the risk of stroke, brain hemorrhages, or sudden spikes in blood pressure, particularly in the early morning hours when a human brain is most vulnerable. If you have ever taken vitamins D, E, B6, A, or niacin, the information presented here could be vitally important. We will begin with the most surprising of them all, vitamin D. A lack of understanding about its effects can turn ordinary nighttime sleep into a potentially dangerous period. It is widely known that vitamin D plays a crucial role in maintaining bone health, stabilizing mood, and strengthening the immune system. All these statements are true, but only when consumed in moderation. However, there's a vital aspect most older adults are often unaware of. An excessive amount of vitamin D, especially when taken in the evening, can subtly but substantially increase the risk of stroke. This discovery may seem shocking, but neurologists have repeatedly observed such cases in their clinical practice. Consider the story of Mr. Walter, a 74-year-old retired Navy veteran. He was sharp-minded, disciplined, and highly responsible about his health. Every morning, with remarkable punctuality, he would arrange his dietary supplements, which invariably included a 10,000 IU over-the-counter vitamin D capsule. Mr. Walter genuinely believed he was protecting his bones, completely unaware that this seemingly innocuous routine was slowly but surely pushing his body toward a silent catastrophe. One morning, his wife found him in a state of profound confusion. He couldn't speak clearly, and his right arm hung limply. It was a stroke that had occurred overnight. Medical tests revealed dangerously high calcium levels in his blood, along with signs of arterial hardening and unstable blood pressure. The cause of all these issues was vitamin D toxicity. When high doses of vitamin D are taken, especially without proper medical supervision, an excessive amount of calcium accumulates in the bloodstream. The body cannot efficiently utilize all this excess, so it directs it into the arteries, leading to their hardening and narrowing. This, in turn, significantly increases the likelihood of a blood clot forming and traveling directly to the brain. With age, human arteries naturally lose their elasticity. Add dehydration, insufficient sleep, and a nighttime calcium surge, and you create ideal conditions for a stroke. The most alarming aspect is the complete absence of warning signs. A person goes to sleep feeling perfectly healthy and wakes up with a life forever changed. It's important to note that many over-the-counter vitamin D supplements contain significantly more active substance than what older adults truly need. Dosages of 5,000 IU or even 10,000 IU are commonplace. People take them daily, mistakenly believing that more is better. However, scientific research indicates that even 2,000 IU per day can be excessive if a person doesn't have a confirmed deficiency. It must be emphasized, if you're taking vitamin D, especially in combination with calcium supplements or heart medications, it is crucial to regularly monitor your blood levels and always take it in the morning, not before bed. If this information has surprised you, prepare yourself. The next vitamin, which many take for heart health, can lead to an even more dangerous condition in older adults than thrombosis, a brain hemorrhage. We're talking about vitamin E. Vitamin E, often called a heart helper, enjoys widespread popularity. Many people over 60 have included it in their daily regimen for years, aiming to support their cardiovascular system, improve circulation, and perhaps even boost memory and skin condition. However, supplement labels rarely provide a critically important piece of information. Excessive vitamin E intake, especially when combined with common cardiac medications, can significantly increase the risk of an intracranial hemorrhage. Yes, this can happen even if a person meticulously follows all their doctor's recommendations. Specialists often recall a story that serves as a stark warning. Mrs. Evelyn Brooks, an 81-year-old retired librarian from Ohio, was a woman with a sharp mind, a lively sense of humor, and an enduring love for books. She had a heart valve issue and regularly took warfarin, a widely used anticoagulant. Her doctors carefully monitored her condition. Her blood tests were normal, and her blood pressure remained stable. But one day, Mrs. Brooks purchased a bottle of natural vitamin E advertised in a magazine. The dosage was 800 IU per capsule. "I thought it would help my memory and circulation," she explained later. Just 3 weeks later, she was rushed to the emergency room with excruciating headache, confusion, and vomiting. A brain CT scan revealed a hemorrhagic stroke, a massive bleeding inside her skull. The cause was not high blood pressure or a fall, but a critical thinning of her blood, triggered by the combination of warfarin and high-dose vitamin E, which rendered her blood unable to clot normally. One of the fragile vessels in her brain simply gave way. Most people don't realize that high-dose vitamin E acts as a powerful natural anticoagulant, slowing down the blood clotting process. If a person is already taking aspirin, Plavix, or any other blood-thinning medications, and then adds vitamin E to their diet, the risk of internal bleeding subtly but significantly increases, especially in the brain. Even a small hemorrhage in this area can lead to loss of speech, memory, or mobility. Remarkably, the recommended daily allowance of vitamin E for older adults is only 15 milligrams, or approximately 22 IU. Nevertheless, most supplements found on pharmacy shelves contain 200, 400, and even 1,000 IU per capsule. There are no warnings or recommendations to consult a doctor, and many people take such doses daily for years. Mrs. Evelyn survived, but now relies on a cane. Her short-term memory never fully recovered. With tears in her eyes, she confessed, "I just wanted to help myself. I didn't know I was harming." This story evokes deep sympathy, as it is not an isolated incident. Many older adults mistakenly believe that if it's a vitamin, it must be completely safe. However, the truth is that not every vitamin is safe, especially if a person is taking heart or blood pressure medications. It is crucial to discuss any new supplements with your doctor before incorporating them into your diet. If the thought of a brain hemorrhage wasn't frightening enough, there's another vitamin that people take to support their nervous system and boost energy, but which can subtly, and sometimes irreversibly, damage nerves. We will now discuss vitamin B6. Vitamin B6 is often marketed as a means to support the nervous system or stimulate brain activity. You can find it on pharmacy shelves in bottles claiming it boosts energy, improves concentration, or even memory. Perhaps someone even convinced you that this vitamin is particularly beneficial for aging nerves. However, there's a crucial aspect that most older adults are never warned about. Excessive amounts of vitamin B6 can actually harm nerves, and sometimes this damage proves irreversible. Consider the case of Mr. Harold Jenkins, a 76-year-old retired truck driver from Kansas. He sought a specialist for complaints of numb legs, tingling in his hands, and impaired balance. At first, he thought it was just signs of aging. Then he started falling. First once, then again. The third time, he hit his head on the bathroom floor. When his list of supplements was analyzed, the problem became clear. For over a year, Mr. Jenkins had been taking a nerve support complex. The label claimed it promoted brain health and improved circulation. However, each tablet contained 100 milligrams of vitamin B6, and he was taking 2 tablets a day. This amounted to 200 milligrams daily, a dose more than 10 times the recommended safe upper limit for older adults. And here's the most alarming part. Unlike some vitamins that are easily flushed out of the body through urine, B6 accumulates in the system over time. In older adults, this accumulation can damage the protective sheath around nerves, akin to stripping the insulation off an electrical wire. The result of such damage includes tingling, numbness, muscle weakness, tremors, and even confusion or memory problems. What's worse, the symptoms appear slowly and gradually. Many people mistakenly attribute them to arthritis, natural aging, or early-stage dementia, when in reality, it could be B6 toxicity, a slow but preventable nerve damage caused by a pill that was supposed to help. And this condition can become irreversible if not detected early. Mr. Jenkins was fortunate. The supplement was discontinued, and the damage did not worsen, but he still needs to use a cane and no longer drives. He confessed, "I just wanted to protect my brain. I didn't realize I was poisoning it." It should be clearly understood. Vitamin B6 is important for the body, but only in very small quantities. Older adults need only about 2 to 10 milligrams of vitamin B6 per day, and this amount already includes what is obtained from food. However, many brain support supplements, sold both online and in physical stores, contain 50, 100, and even 200 milligrams of this vitamin. Such dosages are not just excessive. They pose a serious health risk. Perhaps now you might be thinking, at least some vitamins like vitamin A must be safe. After all, it's solely for vision, right? Unfortunately, that's not entirely true. Let's take a closer look at vitamin A. If you're like most older adults, you've probably heard that vitamin A is vital for maintaining good vision. Perhaps you've even taken it to boost your immune system, improve skin condition, or because someone convinced you of vitamin A's ability to promote graceful aging. However, almost no one warns, especially those over 60, about the following. An excessive amount of vitamin A doesn't just passively accumulate in the body. It actively builds up, and over time, this can lead to increased pressure inside the skull, mimicking stroke symptoms, harming vision, and even negatively impacting brain function. Consider the story of Miss Dorothy Simmons, a 79-year-old retired piano teacher from Oregon. She adored music, taught students in her living room, and prided herself on her independence. But one day, she started experiencing headaches. Then came blurred vision. This was followed by dizziness and slurred speech. Her family feared the worst, a stroke. However, when a brain scan was performed, something surprising was discovered. No clot, no bleeding. Instead, she had significantly elevated intracranial pressure. Too much pressure inside her brain. Her cerebrospinal fluid was stagnant, and the tiny veins in her brain were under pressure. The cause? Vitamin A toxicity. She had been taking a high-dose supplement for skin and eyes for over 5 years, almost 10,000 IU daily, every single day, completely unaware of the potential harm. The key difference with vitamin A is its fat solubility. This means the body stores it in the liver, tissues, and even the brain. It is not excreted like, for example, vitamin C or B. And with age, liver function slows down, accelerating the accumulation process. When there's too much vitamin A in the body, it can lead to a condition known as pseudotumor cerebri. Symptoms include headaches, blurry or double vision, dizziness, nausea, and potentially irreversible vision loss or cognitive decline. The insidious nature of the situation is that many multivitamins already contain the full recommended dose of vitamin A, but some people like Miss Dot unknowingly double or triple it by adding specialized skin, eye, or anti-aging formulas to their regimen. The safe upper limit for older adults is approximately 2,500 to 3,000 IU per day, and that's only if necessary and under strict medical supervision. However, many supplements sold online contain 5,000, 10,000 IU, or even more. When taken daily for several months or years, it's easy to see how the harm accumulates. Miss that is slowly but surely recovering. However, she now requires regular ophthalmological exams, intracranial pressure monitoring, and therapy to restore her balance. She said, "I thought I was doing something good for my body. I never imagined it could harm my brain." This is why specialists share her story, not to scare anyone, but to provide facts that will allow you to protect yourself and your independence. If the thought of the risk associated with vision vitamins seemed alarming, you should know what happens when a vitamin intended to lower cholesterol and support heart health suddenly causes blood pressure to spike. We will now discuss niacin, or vitamin B3, which many may have already taken or been advised to take for their heart. Niacin, also known as vitamin B3, is often lauded as a natural remedy for lowering cholesterol levels. Some medical professionals even prescribe it to their patients. This vitamin can also be found in heart health supplements, energy drinks, and fortified cereals. However, there's a crucial aspect often overlooked, especially concerning older adults. High-dose niacin can subtly cause severe blood pressure fluctuations and even trigger a stroke. Consider the case of Mr. Frank Miller, an 82-year-old retired postal worker from Florida. He came to the doctor with a strange set of symptoms: facial flushing, a pulsating sensation in his chest, and dizziness that came and went every morning. His wife thought it was anxiety, and his son blamed his blood pressure medication. However, the true cause was something no one thought to check. Frank was taking an over-the-counter heart health supplement. The front label read, "Supports cholesterol and circulation." The back, 1,000 milligrams of niacin per serving. He was taking it twice a day. This amounted to 2,000 milligrams daily, a dose more than 60 times the amount most older adults actually need. Here's what happens when you take high-dose niacin. It causes sudden dilation of blood vessels, which can lead to facial redness or a hot sensation. But soon after, those same vessels sharply constrict. This sudden constriction can raise blood pressure, put extra strain on the heart, and reduce blood flow to the brain. Over time, this yo-yo effect is like hammering fragile glass. Eventually, something breaks. Frank experienced what is known as a transient ischemic attack, or TI, a mini-stroke. His speech was slurred for 2 minutes, then recovered. He thought it was a fluke. The specialist had to tell him the bitter truth. His daily supplement, intended to help his heart, was subtly harming his brain. And he is not alone. Many older adults take high doses of niacin without even realizing it. They purchase flush-free or extended-release forms online, mistakenly believing they are safer. But even these versions can still raise blood pressure, cause atrial fibrillation, and affect blood sugar levels. It's important to know, for older adults, anything exceeding 50 milligrams of niacin per day should only be used under medical supervision. And if you have high blood pressure, heart rhythm problems, or are taking medications, it is crucial to carefully check labels. Frank is now recovering with no irreversible damage. But he said something the specialist will not forget. "Doctor, I thought I was doing everything right. I didn't know I was risking my brain." So, after examining 5 common vitamins, each capable of subtly harming the brain, you might be wondering, what should I take instead? Or even better, what should I eat? Let's consider real food, the kind that protects the brain without any risks. At this point, you're probably asking, if these vitamins can be risky, what should I do instead? That's an excellent question, because the truth is the human body wasn't designed to run on pills. It was designed to thrive on real, whole, natural, nutrient-rich food that the brain recognizes, absorbs, and uses in the right amounts. Consider Mrs. Margaret Wilson, a 73-year-old retired school principal from Arizona. When first met, she pulled out a box overflowing with supplements. Vitamin D for bones, vitamin E for her heart, a B complex for energy, niacin for cholesterol, a multivitamin, and several more for brain support. "I'm doing everything right, doctor," she said. Yet, she was experiencing morning dizziness, balance issues, and her blood pressure kept rising. Something wasn't adding up. So, something radical was done. All that clutter was eliminated. One by one, the pills were removed and food took their place. No magic diet, no fancy programs. Just simple, whole foods at the right time and in the right combinations. Here's what her breakfast looked like. 1 hard-boiled egg for clean protein. Half an avocado, rich in healthy fats. A slice of whole grain toast for slow, steady energy. A handful of blueberries, packed with brain-protecting antioxidants. A glass of room-temperature water for brain hydration. Sometimes she added a few walnuts or almonds. That's it. No powders, no pills, just food. Real, recognizable, nourishing. In just a few weeks, Margaret noticed a significant difference. Her dizziness disappeared, her blood pressure stabilized, and her energy returned. And she reported that her mind felt clearer than it had in years. Here's why it worked. The brain needs hydration, healthy fats, consistent fuel, and micronutrients in their natural form. It doesn't need megadoses, it needs balance. Some of the best foods for older adults include leafy greens like spinach and kale, rich in folate and antioxidants. Fatty fish like salmon or sardines, full of omega-3s to protect brain cells. Berries for polyphenol that reduce inflammation. Nuts and seeds for vitamin E, magnesium, and brain-healthy fats. And whole grains to maintain stable blood sugar and support circulation. And remember, these foods don't just protect the brain. They also support the heart, bones, mood, and mobility. You're not just eating, you're healing with every bite. A final wake-up call. Awareness is the best medicine. At this stage of life, every choice matters more. And the truth is, what truly protects you isn't the pills you take, but what you understand about them. Your body at 60, 70, or 80 processes supplements differently than it did decades ago. Even good intentions, like taking vitamins, can subtly turn against you if you're not careful. That's why awareness is the most powerful medicine. Don't fear vitamins, but treat them with respect. Read labels carefully, consult your doctor, and listen to your body, especially when it gives subtle signals.